This is a very important discussion that we'll have this morning, so I'm delighted that you are all here. I want to start by thanking our sponsors this morning. Through their generosity, programs like this are made possible. Our two sponsors this morning are the Dupree Companies, and Steve Dupree is here joining us this morning at the speaker's table. Thank you, Steve. And also Mason and Rich, and Leslie Walker is joining us at the speaker's table. Two of our board members, by the way, I should mention. As I mentioned earlier, this is a very important subject matter today, very serious. We've put together a panel of 4 people that are deeply involved in the issues of homelessness and drug abuse in our community. We enjoy among the highest quality of life anywhere in the world, but still this community has its challenges, and we've got some wonderful people that are dealing with this on a daily basis. So you'll learn a little bit more about this morning. The way this program will work, I will ask each speaker to come up. I'll introduce them individually. They'll come up and take no more than 10 minutes, 5 to 10 minutes apiece at the podium, and they'll take a seat. When they're all finished, we'll have a few minutes left over from Q&A from the audience, so if a question comes up, please hang on to that, and we will take questions at the very end. So our first speaker is Chief Brad Osgood from the Concord Police Department. Chief Osgood began work in the Concord Police Department 26 years ago, starting in 1989. He served as a patrol officer in the division, and in 1998 he was transferred over to Youth Services Unit. In 2001, he was promoted to sergeant and assigned as a patrol supervisor. In 2003, Sergeant Osgood was transferred to the Training and Services Division. Later, he was promoted to lieutenant in 2004 and served as a watch commander. In 2007, Lieutenant Osgood was promoted to the rank of major, which was later reclassified as deputy chief. And in this position, Deputy Chief Osgood was responsible for the department's operating budget, oversight of Training and Services Division, Community Resources Unit, Records Division, Planning, Analysis Unit, Federal Unit, and Parking Division. So he's got a little bit of everything in the police department. He's got a BA in psychology, graduate of the University of New Hampshire, and Riviera University, where he earned a Master of Business Administration in 2008, graduate of the 235th session of the FBI National Academy in Quantico, Virginia. So please join me in welcoming Chief Osgood to the podium.
Thank you. I'd really like to thank the Chamber for putting on this very important discussion this morning. And I think the question that was presented to me a few weeks ago by Tim, he asked me to answer or try to answer the question for today, and it went like this. It says, how is homelessness and heroin impacting crime and safety, and how is the Concord Police Department responding to this within this community? And I thought long and hard about that, homelessness and heroin. And what I wanted to say first and foremost is the two are not necessarily related. A person that is homeless is not a heroin addict. Is it possible that the person that is homeless got a substance abuse problem? Yes. But do not ever think that a homeless person is a heroin addict, and I just wanted to say that. Homelessness in Concord, for those in the community, have probably noticed over the last several years has really increased. And I think that my colleague Ellen is going to talk in a little bit, but I think homelessness is getting much better in this community over the past couple of years, and that's because of the community involvement. I think the mayor did a fantastic job. I have to give him his plug. He's back there. But he did a fantastic job establishing a committee to study and research homelessness in this community, and I think we're going to see the dividends paying off in the near future. Homelessness, what we were seeing in the last few years, probably 2 or 3 summers ago, is we were seeing a lot of violent crime within their own community. And so we sought to kind of break apart their communities and sort of displace them. And I know that probably ruffled some feathers, but by displacing them and making them disperse into smaller pockets, really cut down on the violence that was occurring in those communities. Late last summer, we established at the police department what's called a POP unit, which stands for Problem-Oriented Policing. And these particular officers made it a priority to visit the Friendly Kitchen, the Concord Public Library, Main Street, and they really got to know all of the homeless population in Concord and really worked with the shelters and other providers to really try to assist them. And I think we've gone a long way in solving some of the issues. But we have a tremendous amount of work to do, and this is not an issue that's going to go away anytime soon. We are preparing for a winter without a shelter in Concord. The shelters that we're operating for the last several years, we're preparing for that, and we'll see how that progresses. So let's talk about heroin in the community. I took over, and I've told this story many, many times, and I'm sorry if some of you have heard it, but John Duval retired in December of 2013, and I took over as the interim chief at the time. And I remember that that first weekend, or the second weekend that I was at home, and I got calls from the department, from the watch commander, that we had 3 overdoses in Concord on that weekend, and we had 2 fatalities. So I started really researching and investigating this heroin problem in the community. And I've been talking about this every week. Every week on a radio show, I've talked to the media, I've been talking about the problem of heroin. And on Father's Day of this past summer, I was having dinner with my family, and while I was eating, I got notified 3 times in the course of an hour and 10 minutes that we had 3 overdoses in Concord. So the problem continues as of last night at 10 o'clock. Our patrol officers and firefighters were responding to overdoses in Concord. You probably read or see on Channel 9 that Manchester had 6 overdoses, 2 nights ago. They've had over 500 calls this year for overdoses. Upwards to 60 people have died. And I remarked as I was leaving work yesterday to be prepared. Deputy Chief Taylor's here, and he was present, and I said to the watch commander, be prepared, because Concord is not that far behind Manchester. And sure enough, last night we ended up with an overdose. And fortunately, the fire department was able to save that particular individual. But to give you some background of what's happening with heroin, and I do want to be brief so that I can allow the other speakers to have some time. And I also wanted to mention, too, that after this event, I will remain here. I'll be out in the hallway for as long as, if you have any questions, I will stay here as long as I need to answer any questions about either of the issues that we're talking about today. But just to give you an idea, what's happening in Concord is that in the year 2012, there were 2 people in Concord that died of a heroin overdose or an opiate-related overdose. In 2013, that went to 4. In 2014, that went to 13. As of today, in 2015, there have been 8 in Concord, so that we're projecting about basically the same rate as last year. Manchester has reported that they have responded to roughly 500 overdose calls this particular year. And we are probably right around 100 year to date. Our response time is on average just under 3 minutes, which is very, very good. Usually by the time we get to an overdose case, the fire department is already there, which is fantastic. Each call that we go on, we spend roughly 3.5 hours either at scene or part of this investigation. That's a tremendous amount of resources that we're pouring into this particular problem. There is no, it affects both genders. As a matter of fact, the deaths, the 27 deaths that we've had in Concord, there are 15 men, 12 women. The age range is from 19 years old to 56 years old. And some people in the community always ask, well, is this a downtown problem? Is it, you know, where is this happening? It's not in my neighborhood. Well, it happens everywhere in the community. And in our patrol beats, we set the city up in a sector, so we have different patrol areas that cover the entire city. And it's pretty evenly spread throughout the entire city where we're responding to these calls. In fact, I've listed the top 3, and they're fairly close. You know, there's really no difference, but really the number 1 area is the Pennacook area. And we classify Pennacook area in Concord as anything north of, say, Sewell's Falls Road and out towards Bog Road and Elm Street and into Pennacook Square. That whole area is covered by 1 patrol beat. The second area, which is not far behind, it's a matter of just 2 calls, is the downtown area, which covers South Main Street, South State Street, Broadway, Hall Street, if you're familiar with those areas. And the third one, which is only 1 call behind that, is actually on the Heights, which is Loudon Road and East Side Drive, Portsmouth Street, in that particular area. But like I said, no matter which patrol beat that we look at, they're all right there. It's pretty evenly spread throughout the entire city. You know, as far as what we're doing, and I'll be less than 2 minutes on this, is what we're doing is we have a very active drug enforcement unit. You know, we're in the middle of an epidemic, you know, so-called epidemic in this state, maybe even this country. I'm using essentially the same resources today to fight this epidemic that I was 3, 4, 5 years ago. And I'm constantly studying that with my command staff, and it's probable that very soon we're going to be making some changes to increase that effort. We get involved, let's see, and just to give you an idea of some other statistics here real quick, which I don't actually have them here. Our number of offenses that we had for drugs from the year 2010 to 2012 was pretty flat. We were handling in the low 300s. That means that's the number of drug offenses that we were investigating per year. That's through 2012. And this is when we started, in 2012, at the end of 2012 is when we started to see really the heroin overdoses begin. And as we entered 2013, 2014, and 2015, we've gone from 300 offenses, and I'm projecting we're going to be into the mid-500s this year. That's a lot of work. That's a lot of drug activity that's occurring in this community. And my last thing is, I think that chiefs of police, and I speak for myself, and I speak with other chiefs, and I speak for all officers, when they look at this problem of heroin and fentanyl, and one of the big emerging threats to our community and to our state is going to be methamphetamine. When we look at this, and we look at the users and the people that are addicted, many, many years ago, we saw those people as bad people, bad guys. And I think we've come 180 on that, 180 degrees. We really see this as an addiction and that they need help. And we're sympathetic to that. And we are doing our best to work with any of the stakeholders that can offer assistance. And my last thing is that one of my detectives has put together this particular document, and I'll show it to you here. It's a document that he creates, and it's confidential because he has some confidential information on it. He has aliases and associates and who might be associated with these people. But this is a list of the people that have died in Concord as a result of heroin. And I keep this on my desk right next to my keyboard every day because it has the pictures of the people that have died. And I think that really makes this problem, it's not when you watch TV and you say, oh, 60 people, 12 people. These are the people. You don't see this on TV. These are the people. And I think it's important that all of us as police officers know that these are people, and we need to help them. And I think that the state is hopefully going to be on the right track with treatment and recovery, and we'll hear some people speak to that this afternoon or later this morning. But I'm going to end right there, and I will be available for questions. And again, I will be out in the lobby as long as I need to this afternoon or later for the morning. Okay? Thank you very much.
Thank you, Chief. One of the cool things about running programs like this is you work with these folks in the community, but you really get to learn a little bit more about them as you get their bios and find out what they did in the past. And our next speaker is Ellen Grow. Ellen was hired as the executive director of the Concord Coalition to End Homelessness in February of 2014, just as Concord's plan to end homelessness was about to be adopted by the City Council. So, since being hired, much of her work has been focused on bringing together the stakeholders to implement that plan. Ellen has a long history working on poverty issues. She was formerly worked as legal services attorney in North Carolina and in affordable housing development with the North Carolina Housing Finance Agency, as well as working with a private developer of affordable housing. Ellen is one of the founders of the Sauhegan Valley Rides, an affordable dial-a-ride bus service for medical appointments and other essential services available in Amherst, Milford, Hollis, and Brooklyn, New Hampshire. She holds a Juris Doctorate from the University of North Carolina School of Law and a Master's of Public Health from Harvard School of Public Health. So please join me in welcoming Ellen Grow.
Good morning. Thank you for the opportunity to come and speak about this really important issue. I'm gladdened to see so many people here, so many people concerned about it. And I really appreciate Chief Osgood's remarks about these are individual people that we're talking about, and to never forget that. I want to start by saying I am definitely no expert on opioid addiction and spent the last week calling everyone that I knew to brush up on the background of it, because that's not my area of expertise. So I do know, so anyone can jump in later in the conversation, please, and correct anything that I say that I might have been mistaken about. I do know that the problem is much larger than just heroin, and that we need to speak about opioids in general, because a lot of people do start their addiction from prescription drugs that were prescribed to them for a major injury or something, and they stayed on too long and became addicted. I also want to echo what Chief Osgood said about this is not an issue that's confined to people who are living in poverty or living in homelessness. It cuts across all economic lines, gender, age. It's affecting everyone. I will say that people who are struggling with homelessness are obviously more vulnerable. Their lives are in crisis. They're struggling just to stay alive sometimes. So I think the temptation to escape into a drug like heroin would be very tempting. And also, living on the streets, you're probably much more likely to come in contact with someone who would have some heroin to share with you than I would be. So I do believe that homeless people are much more vulnerable, though it's affecting everyone. I tried to find some statistics, and they are just not available as far as the number of people who are struggling with homelessness who are also addicted. That kind of database just doesn't exist. Whether even people who have passed away, we don't always know, were they homeless when they passed away from an overdose. So it's hard to really pin it down, and there is such a stigma involved with this that people are very hesitant to come forth and admit that they're having an issue. As far as what we're seeing, we run a resource center. You probably know we just moved to North Main Street across from Friendly's, and we see about 30 people a day, I would say. And as far as obvious signs, I was speaking with the staff that work more one-on-one in that center. They said probably only 3 or 4 people show clear signs of probably being addicted to opioids. I know, so it's not a large population that we're seeing, at least that's really obvious in our resource center. I know, though, at the cold weather shelters last winter and for the last few winters, they were absolutely seeing a rise in heroin use and finding needles in the bathroom. And that was one of the reasons that they felt like they couldn't continue to run those shelters. They felt like they just were not equipped to deal with that issue. They're mostly run by volunteers, and they didn't feel like they had the expertise to deal with that. I know from speaking with the Community Action Program, the CAP outreach worker, that he did feel like there were several big camps down by the river where there was a lot of opioid use going on. Those folks did not tend to come into our resource center, but he felt he could feel it, absolutely, could see the rise in the summertime in the camps, and felt unsafe there himself, which is pretty unusual for Andy Labrie. If anybody knows him, he'll go anywhere, and he felt unsafe. Our resource center manager used to work at the resource center in Manchester, and he did feel like there was certainly much larger issue in Manchester. Of the 150 people who came through their resource center, he said a good 20 or 30 were clearly under the influence of opioids, and they would find them shooting up in the bathroom. So it was a much tougher problem, I will say, in Manchester, and we may be headed that way as well. So as far as initiatives to end homelessness relate, I would say, I hope everyone has heard of the Housing First model that we are really advocating for, and that we have just received funding for a caseworker for. So we're really excited about that. And I would say that the Housing First model fits right in to one of the strategies that can help address this issue. So the Housing First model is based on a simple idea, and that's that the ability to stabilize your life, the foundation for that is a stable home. I can't imagine trying to fight an addiction problem if I was living in the woods or staying in a shelter and had all of that added stress. I can't imagine being able to take on that challenge of becoming clean. So the Housing First idea is that we take you as you are. We take you with your addiction. We take you with your criminal background. We take you with your untreated mental health issue, and we put you in a subsidized apartment so that you can afford it, and we provide you with an ongoing caseworker. That caseworker is with you for years, if that's what it takes. That caseworker is with you by your side and does not give up, no matter how many times you fail, no matter how many times you try to get clean and go back. They're with you. They stick with you and provide that connection and support to be able to deal with the underlying problems that may have caused or contributed to your homelessness in the first place. So I feel we're launching that program here. It's certainly, we have a caseworker who's going to be able to handle 12 to eventually maybe 30 clients. That's not going to solve the problem, but I do see it as one of the strategies that can feed into what else is going on in the state. The good news that for Concord, as I understand it, and Peter Evers is here today, and he could probably speak much more eloquently and knowledgeably towards this, but I think there's a lot of effort around treatment and recovery in Concord right now. There's a group that's been meeting, a collaborative impact group that involves the hospital and the Family Health Center and Riverbend Community Mental Health and the Bureau of Drug and Alcohol that are working together to bring together the strategies that are going to help people recover and stay recovered. And I also appreciated what you said, Chief Osgood, about this is this is a medical problem. This is a sickness. This is an illness, and people need to be treated with compassion and helped to recover, rather than focusing on the criminal act of it. People are in need of help. And I will close with, I know that the New Hampshire Health Protection Plan has provided coverage for substance abuse to people who were never able to access that before. Those are for people who are of the absolute lowest income. And I know that has been crucial for many people to address both their substance abuse issues and mental health issues, which often go hand in hand. A lot of people turn to opioids because they're self-medicating for their mental health issues that are untreated. So I know the New Hampshire Health Protection Plan has been a critical part of that. And when the legislature takes that up again in January to reauthorize that, I think it is absolutely essential that be reauthorized if we're to have any hope of addressing this issue with the lowest income people. So thank you.
Thank you, Ellen. Our next speaker is Lieutenant Lenny O'Keefe. Lieutenant O'Keefe began working in law enforcement back in 1990 as a part-time patrol officer for the town of Boscawen, and he also worked part-time at the town of Pittsfield, and then as a full-time patrolman for the city of Franklin. In 1997, he joined the Merrimack County Department of Corrections as a corrections officer, and he remains employed there today as the training coordinator. While working there, Lieutenant O'Keefe has been the training corporal, a member of the special response team, the security threat group coordinator, and in 2004 worked on a 5-member transition team that oversaw the construction and coordination of the jail, which opened in August of 2005. He has spoken to community groups, schools, colleges, the Air National Guard, and other local law enforcement agencies on topics such as security threat groups, otherwise known as gangs, drugs, and adult corrections. He has taught at the New Hampshire Association of County Corrections Academy and the New Hampshire State Police Academy. Lieutenant O'Keefe is no stranger to the Chamber of Commerce. He served as past chair of the Leadership Greater Concord Steering Committee, and he also serves as a member of the Capital Area Student Leadership Program at the Chamber. In 2004, he was awarded the Correctional Officer of the Year by the New Hampshire State Grange. And in 2013, Lieutenant O'Keefe was recognized on the national level as he was awarded the Correctional Trainer of the Year award. From the Chamber, he received the W. Grant McIntosh Volunteer of the Year award. In 2005, he received the Employee of the Year award from Merrimack County Department of Corrections. He is a father of 4 and resides in Concord. So welcome, Lieutenant.
Thank you very much for having me here. I've got about 11 slides I'm going to go through, so I'm going to start. Working in law enforcement in the community you grew up in, I get a lot of calls from moms and dads. I get a lot of calls from husbands. I get a lot of calls from wives saying, my loved one has just been put in your jail. What do I expect? Because all they ever see is what they see on TV. And trust me, what you see on TV is not what it's about. So I'm going to start with 2 quick stories. So in a jail, we have a short-term and we have long-term goals. Short-term goal is public safety. And we do pretty good. You don't see a lot of people running away from our jail. Long-term, we also have a public safety goal too. And that's what we're working on, and that's what I'm going to talk about today. About 10 years ago, I got a call from a lady who wrote this book. She's from Concord. The book is called Peeling the Onion. And I was coached basketball for many years with her husband. And they called and said, my son's in your jail, what do I do? 10 years ago, my advice was, get him out of here as fast as you can. It was a Sunday, they had to borrow some money, and they were able to bail him out of jail. Their son now is 7 years sober, he owns his own business, and he's doing really, really well. One of the things people need to realize is the people that come into our facilities, 96% of the people that go to jail and prison in the state of New Hampshire get out. So we can put these people in jail and we can put these people in prison and we can warehouse them, but understand when they get out, it's the same people we put in there. So to make our community better, we have to have programming inside our jails and prisons. Recently, I got a call, probably about a month ago, from a friend that I hadn't seen in a long time. And she says, my son's in your jail, what do I do? And I said to her, I said, it's a good thing. 10 years ago, I said, get him out. Now I said, it's a good thing. This is Brennan. Brennan bailed himself out of our jail, and Brennan has been on the run for 2 months now. Brennan is an addict, and Brennan's mother, who I invited here today to see these wonderful people, to understand that we're trying to do something, and she's here. This is the Brennan that she's talking about. The Brennan on the other side is the Brennan that we see in the news. Brennan is still out there. He's still on the run. And I pray and I hope every day that Brennan gets brought into our jail so that we can help Brennan. We are starting a new program at the jail. It's an evidence-based practice program. It targets high-risk offenders. What a high-risk offender is that's somebody that comes into our jail that has high criminogenic risks, meaning that the likelihood of them to reoffend again when they get out of jail is very high. So the program we have started in our jail targets these high-risk offenders. This is the criminogenic needs for reintegration, and this is what the programs are based on. You can see participation in the above-ground economy, employment, good relationship choices, education, housing and community, control of addictive behaviors, and family relationships and parenting. This is what somebody needs, and this is what these people need to learn to reintegrate, to go back into society. So many of the programs we start in jail use this model right here, and we look at these needs, and we help these people, and we help these people fix these issues inside of our jail. What are criminogenic needs? Criminogenic needs over on the far side is a history of antisocial behavior. A lot of people don't understand antisocial behavior. Antisocial behavior is not somebody sitting at home alone. Antisocial behavior is people that basically don't believe the rules belong to them. So the people that we get, these high-risk offenders, have this history of antisocial behavior. They also have antisocial personality patterns. They are adventurous, they're pleasure-seeking, they have weak self-control, and they're restlessly aggressive. They have antisocial cognition. Their attitudes, their values, beliefs, and rationalizations are supportive of crime, cognitive emotional states of anger, resentment, and defiance. They have antisocial associates. They hang out with the wrong kind of crowds. Family and/or marital issues, two key elements. School and/or work. These are the people that are working at low levels in school, and they have no satisfaction either in their job or in what they do in school. Their leisure and recreation is low levels of involvement, and their satisfaction is artificial leisure pursuits. And substance abuse plays a very, very big part in this whole model here. So in our jail, we look for these people and we put them in these programs. The cognitive behavioral strategies is part of what this program is. It's to get them to think a different way of thinking. In fact, the program that we talk about is called Thinking for a Change. It's really to help them think differently. And I spoke to Ellen about a week ago, and we are actually going to do some cross-training so that the words and the stuff that we're talking about inside of our jail will be the words and the stuff that Ellen and her staff will be talking about too. So I'll just go on. Offender attributes. These people are impulsive, they're egocentric, they're habitual, antisocial behavior, and they're rigid and narrow-minded. What we do is we do this thing called this cognitive restructuring. We actually change the attitudes, beliefs, habits of thinking that lead to this criminal behavior. We have them, during this program, pay attention to their thoughts and feelings. When you're working, it's a little different working with a male group than it is a female group. Men in our society don't have thoughts and they don't have feelings. We're mad, sad, glad, and happy. And it's funny because when you work with these guys in these programs, they do find out they have many, many, many more feelings. But they recognize when their thoughts and feelings have a risk of leading to something hurtful. And they also use new thinking to reduce risk. And then we practice this over and over and over and over. In this program, they have thinking reports. And if they have an issue during the day, they go through a report and they have to write down what the issue was. They have to write down what their thoughts, their beliefs, and their values are associated with this issue, what their initial thinking was, and then they have to at the end of this thinking report, they actually will write down the good decisions that they make. This is one of the themes. By taking charge of your thinking, we can take control of our lives, and this is true. Cognitive self-change is, again, paying attention to the thoughts and feelings that go on inside of us to avoid the kinds of thoughts and feelings that lead us into trouble. We have to teach these people these concepts. There are people out there that don't have these concepts. When these people get brought in, if they are a substance abuser at the time that they come in, of course, we're going to start there. We can't take someone and put them into a program like this that's suffering from the effects of substance abuse. So we'll help them come down off their substance abuse and detox, and then they will start into this program. Somebody with mental health issues, when they come in, we'll go through the mental health issues. We'll help them get on their medicine. We'll help them take their medication. And then we will start this program with them. So this program is not something that somebody right off the street can jump into. We fix the other issues that are there before we put them into this program. We work on their social skills, behaviors or abilities we use in situations that involve other people. Because of their antisocial behavior, because they don't believe rules belong to them and they don't have to follow rules, we have to teach them social skills. These people don't have social skills that we have. And then, of course, there's problem-solving skills, skills to help us make better choices. This is the name of the program. This is called Thinking for a Change. It basically is there's conflict in your life, and the way they live their lives and the way they're doing and living their lives now and the way they've lived their lives for a long time, they don't deal with conflict. Thus, there's mental issues, and thus the drug use that goes on too. This is Sullivan County. This is Sullivan County in New Hampshire. This is their county treatment flow. There's an assessment, and there's different tools they use for an assessment, an LSIR. There's ORAS, there's a risk needs assessment, and they decide basically at that point if they're high risk and low risk. And let me just go back. Somebody that's a low risk offender is somebody that's committed a crime and they're not likely to commit a crime again. And there actually is a formula to figure that out. And we do have these people in our jail. Those people are best, honestly, at home on work release. On a bracelet at home. They've committed a crime, they've committed that one crime, they're not likely to commit another crime. They don't need a lot of programming, so it's better they belong at home. I can tell you in Merrimack County now, it's about $140-something a day to house one inmate. This morning we had 201 inmates. If somebody's on a transitional housing, which means a housing where we're going to transition them back out into the community, it's about $100 a day. And if somebody's on a bracelet and we're supervising them at home, it's only about $30 a day for a taxpayers. So you can see getting these people, these low-risk offenders, back home, back on a bracelet program, on a program where they come in and check in once a day, is much cheaper to the people, the taxpayers of our community. Track 2 is inmates are placed in a program. Track 3 is the work release. We get them back out in the community. We get them into work, whether it's work for the jail or they get their own jobs. Track 4 is the post-release. That's where they live like in a transitional housing before we put them back into back into society. And track 5 is relapse prevention, and that's these people showing up after they've been done with their sentences in jails. They actually come back to the programs and they stay involved in the program. It's called, in Sullivan County, it's called the Trails Program. It's been in existence for 8 years. At the beginning of this program, the recidivism of the people that would have been in this program was about 60%. Today, the program, the people that graduate from that program are at about 16%. So you can see that it's evidence-based, it's been around for 8 years, and it's successful in what it does.
Thank you, Lieutenant O'Keefe. So wrapping up the program, we have with us Cheryl Coletti. Cheryl is Vice President of Business Development for Boston Asset Management. She received her bachelor's degree in communications from the University of Massachusetts, Amherst, and her master's degree in business administration from the University of New Hampshire. Cheryl sits on the board of directors for the Greater Concord Chamber of Commerce and the Business and Industry Association of New Hampshire. She is chair-elect on the board of directors for Hope for New Hampshire Recovery, a statewide recovery community organization whose mission is to support addiction recovery in all communities across New Hampshire. She sits on the Governor's Commission on Alcohol and Drug Abuse Prevention, Treatment, and Recovery, representing the business community. She is a graduate of the Leadership New Hampshire class of 2015, and she lives in Concord with her 2 children. Cheryl, welcome.
Good morning. Oh, thank you. Thank you, Tim. I wanted to just say thank you to the 3 panelists beforehand, because the common thread I heard is these are people. This is a community of people that we're talking about. They're categorized as addicts. They're categorized as homeless. They're stigmatized in the most negative way. I watched a talk show the other day. I happened to be somewhere at 9 in the morning, and there was a TV on. And I saw Richard Gere. And Richard Gere was being interviewed, and he's producing a new movie. And he said he was in costume as a homeless person down in New York City next to the Cube. And for 4 hours, he stood there and not one person made eye contact with him. He said, and metaphysically, we're all the same people. So I stand here today to tell you about Hope for New Hampshire Recovery, but to tell you those people, I am one of those people. So I am a person in long-term recovery. So what that means to me is I haven't had to have a drink in over 3.5 years. There was a time when life wasn't great, and life is great today. I'm a contributing member of society. I'm what I consider a great mom. My 8- and 7-year-old may tell you otherwise. And I'm a businesswoman. So recovery is good, and there are those of us that are coming out speaking about recovery, because what I believe is in any organization, if you're not at the table, you're on the table. So I'm here to fight for the community and to fight for the disease and the addiction of recovery. I want to thank Peter Evers. He graciously accepted my begging and pleading to be on my board because it is absolutely accurate that substance abuse and mental illness, there is a dual diagnosis in most cases. The programs we see, there is prevention, and there is a whole host of folks in community on the preventative side bringing awareness. What's scary about heroin, what's different than what you call a garden variety alcoholic, you drink, you get dunked, you throw up, there's a program, it goes on and on and on. You can eventually die from the disease. But what scares me as a mom, and in seeing heroin, you take a needle, you shoot it, and you could be dead because you don't know what's in that. So, you know, when we heard the First Lady years ago, as Steve said earlier, just say no, I don't know how effective that is anymore. Just say, my kids don't listen to me when I say just say no. So what we see is this prevention, and then there's treatment. And if we think we're going to fight our way out of heroin with just recovery and support, and let me talk to you, no, we need treatment. These people that are addicted need a way off of that. But we live in a state that our resources are limited. So what we're here to do in the recovery on the three legs of that stool is we're here to help an already stressed and taxed state resource program. We're here to help keep people who are in recovery so that they don't relapse. There are small little organizations all around the state, clubhouses. There are many pathways to recovery. There are faith-based pathways. There are pathways through AA, NA. Whatever your pathway is, if it keeps you in recovery, that's wonderful. The reason so many of these small recovery support groups fail is lack of funding. I have learned more in the last year than I care to ever learn about the Center for Medicaid and Medicare Administration, Medicaid, the 1115 waiver, the 1117 waiver. I mean, my head just wants to explode. I'm in front of GelCar. I didn't even know what GelCar was until about a month ago. The rules, 300 rules, 500 rules, how you can get reimbursed. I get home at night, my head spins. There has to be a different way to be able to provide the funding. And all of you know that in New Hampshire, nonprofits, we execute on government responsibility. It's just a fact. And there are only so many times I can go to the likes of a Steve Dupree, okay, or a Tom Raffio at Delta Dental and say, hi, I'm here. You want to give me a check? And graciously, business owners do that. So HOPE is really looking to establish a statewide recovery support network of people in community who understand what their communities need. What people in the North Country need is completely different than Manchester. What we need in Concord is different than Derry. So HOPE is an organization. We've convened an advisory panel so that we aren't arrogant enough to tell you we know what recovery looks like. So the panel is people in community that tell us what the local communities need. And we're looking to build an economically viable, sustainable model so that these recovery supports can be given to people. When they come out of a wonderful trails program from the county facilities, when they leave prison, when they leave a detox, they need help. Because again, like Lenny said, the people that are in there are the people that come out. So what can we do to support those people? So that's what HOPE is here to do. People that are struggling with mental illness and addiction, I heard someone say, it was a great comment last night, you're on an elevator, you're going down. Which floor do you want to get off on? I can say I'm fortunate. I've never been to rehab yet. I've never been in jail yet. I got off on a floor that got me off on the floor. So I'm just here to say we're in community and we're just trying to support people that are in our communities. And I think the reason the heroin epidemic has raised such an awareness is because the effects of heroin addiction are much different than the addiction personalities and the addiction we've seen in the past, right? People are dying. The crime rate has gone up. Children are suffering. I mean, can you imagine someone overdosing? The police show up, and there's an 8-month-old in a crib crying right next door. My heart just breaks. So that's what HOPE is all about. And there are people like the people on the panel, like you in the room today. We're all just trying to find a way to help everyone. So thank you.
I don't know about you, but I feel very encouraged when we have people of this caliber addressing these issues in our community. We are very, very fortunate to have you giving your lives and your careers to these very important issues. Well, I think we're just about out of time. I want to thank our panelists for your presentations this morning. Much appreciated. Thank you for doing this. Also, another thanks to our sponsors this morning, Mason & Rich and the Dupree Companies. Thank you for your support of these programs. A couple of very quick announcements, some upcoming events. On a lighter side, if you're into some business networking, don't miss the Tri-City Expo on October 1st. That is 3 to 7 at the Radisson in Manchester. Great trade show. Also, I think we have did we have some free passes here this morning, Valerie? On the table, there's some free passes, so you may want to pick one of those up. We are hosting a City of Concord Mayor and Candidate Forum on October the 20th at 5:30 here at the Capone Conference Center for the upcoming election, and Chamber annual meeting coming up on November 4th. So keep your eyes peeled for those events. Thank you again for coming, and thank you again, panelists.